The two of us got our CNA certification at Kirkwood about 2 years ago.
The summer after our sophomore year.
So, we drove up there every day and did that for over the summer, I think for a couple months. And then we got jobs at
Virginia Day Hospital here in town.
Mm-hmm.
So we work on the floor, the acute floor, and then the ER. And at Virginia Day, we have been doing that for like 18 months.
Yeah, for a while. Yeah, it's been a while now. So, when school was canceled and everything started back, I think mid-March, we started picking up a lot of shifts there. We were door screeners for temperatures, and then we also worked on the floor. And we did that a whole bunch. And when when was it that we did that? I think it was mid-April. It had been about a month that we had been doing that. And we had both seen on the news a lot of stories about how short-staffed things were out east, especially when, not just out east, but also in bigger cities. Anywhere where populations were big, they had problems with staffing issues, PPE. They were struggling a lot more than I think we were back here, and we weren't seeing the sort of numbers that they were predicting. So we felt that Virginia Gay would be able to handle any sort of numbers that came in. They also have a lot more employees, people who come back who are working in college, and then they come back over the summer. So they were, I felt like, a lot more prepared than a lot of places out east were. So when we were seeing that on the news, we decided to apply for, it's called Aya Healthcare. They're an agency that hires nurses, so RNs, LPNs, and then CNAs as well. And when we applied late one night, and we
got a call back the next day.
Yeah, the next day. So, the process happened so fast. I remember when we first got the call, the man on the phone was like, so I think I'll have your contract to you this evening, just be ready to sign that. When that comes, you'll get an email.
Yeah. You're going to New Jersey,
by the way.
Yeah.
And it just kind of all happened so fast. I don't remember if we really picked where we were going exactly. We applied through, I think through the group, they said we were going to the Hackensack area of New Jersey. So we knew roughly the area that we were going to, but we really didn't receive a whole lot of help about what it would be like or anything like that. It all happened so fast because we originally were going to fly, and then when we saw the area, it was a little bit more suburban than we expected. So it was
transportation purposes. Once we got there, we wanted to have a car.
Yeah. And we're too young to rent a car. We're only 18, so we can't rent a car, and we also can't technically rent a hotel. We can't book a hotel when we're 18, so all of that you have to be 21. And so we had a lot of conversations with people like, this is our situation, is anyone willing to help us out here? I mean, there's not much we could do about that. So over our trip, we met a lot of really helpful people who were willing to accommodate us, which was really neat to see.
Trying to think the timeline. I think once they called, we signed a contract 24 hours later. It was something crazy.
It happened fast.
And then we were getting packed up, and I just remember
within a matter of a couple of days, we were already on our way. It was less than a week. We were in New Jersey starting our first day of work. But yeah, it was definitely a lot different once we got there. I think that a lot of the practices changed as we learned more about the virus and different rules and regulations that different bodies of governments, came up with. But it was interesting to see. We didn't run into issues going from state to state like we thought we would.
Yeah, we were worried. We didn't know if you got to a certain state border, if there were going to be security checking, because we didn't know all these states were supposedly on lockdown, so we really had no idea what we were going to be running into. I mean, we had our documentation ready to show that we were essential workers, and they would have let us in, but we didn't run into any difficulties
there. But you definitely saw differences just when it came to different state governments and local governments and the way that they viewed the virus, just kind of had an attitude about how everyone handled it within an area. So where we were living when we first got there, things were definitely on complete lockdown. You couldn't be out on the streets without a mask, and there were a couple of times, I think it was 3 weeks that we were there, 3 or 4 weeks after we were there, one of the parks in our neighborhood opened up, and so Lily and I went to the park, and they have police presence everywhere, and the police would have megaphones and tell people, you need to have a mask, you need to be social distancing. Anytime they saw groups of people congregating, they were split up. I suppose there weren't ever, like, we never saw any, like, problems with that. People just really, most part, abided those rules. But overall, I don't think anyone was going into any of the businesses in the street. A lot of restaurants did takeout, and takeout was allowed, I think, the whole time we were there. So
never dine in.
There was never dine in, and I think they recently, as of like last week, they opened up outdoor dining to 25% capacity, and that was just a couple days ago. So they're definitely,
When you first arrived in New Jersey at the house you were renting, how long did you stay there?
So that's a whole,
we initially
Make sure
booked
we
an
do this stuff.
Airbnb.
I know, I just...
So, we got a housing stipend. So they didn't provide us with housing. They just said, you're allotted this much money to figure things out. And we were told that we would have like a list to choose from and we'd get a discount, and that didn't really happen. So we just kind of had to figure things out for ourselves. And I thought it was a great idea. We'd save a bunch of money and get ourselves an Airbnb. So I picked out the cheapest one, and I learned my lesson there.
Why was it cheap?
Yeah, why was it cheap? It wasn't as advertised. It was advertised like a non-smoking, I think, and when we got there, it was actually kind of sad.
We were in a really,
it was in Newark, New Jersey, and it was a rougher neighborhood. They had a bigger homeless population. There were 3 stories to where we were, and the story below us had over a dozen people living in it. People were coming in and out constantly, little kids.
there was no places to park.
People were
on mattresses
on the street. It wasn't really, we didn't feel like it was a safe neighborhood, and then we also didn't want to be taking out, we had our whole lives packed up in the back of my car, and I didn't really want to be transporting that, especially with us being young, teenage girls.
With our Iowa license plate.
With our Iowa license plate.
That didn't really.
Yeah, we stuck out pretty bad. So we decided that it wasn't probably the safest for us, and I think we had one more day after that. We came early.
We had one day to figure it out, because then we were here and we were like, we had booked that place for like a month. We were planning on staying there, so we had 8 weeks that we needed to find a place to live. We didn't want to just sleep in our cars.
Yeah. So my grandma actually, before I went, she was feeling a little uneasy about it, and I knew that where we were staying, we didn't really know fully what we were getting ourselves into, both, with the medical side of things, where we were living. We had never been out east, even for like vacations or anything. Like Lily and I we had no idea what was going on. So my grandma had originally said, well, I have a friend of a friend who manages hotels out in New Jersey. And New Jersey is a big enough state. I mean, the chances of that working out were very slim. And when I called her, and then she got someone else on the phone,
that day.
And it was about 10 minutes from where we were, and the differences in where we were
driving 10 miles. It's just like a completely different world.
It was a completely different world.
Like
yeah, we ended up staying. It was a Marriott that night where it was about 15 minutes from our where we were going to work, our facility.
And we were very blessed. God was definitely on our side.
For sure. I mean, it was
worked
amazing.
out.
Yeah, it worked out really well. And then the manager of this hotel, when we were talking to him about our situation, because we were just going to spend our next day figuring something out for the next summer months, and he was really generous and said, I am friends with some of the other managers in the area. I'd love to help you out and help you figure something out. And so he got us a little bit of a discount at one of the residency inns. So we had our own little kitchenette and it was a small place, but it was perfect for the 2 of us because we were able to cook some in a stovetop and things like that. So it was crazy how we went just in a matter of those couple days. I mean, it was really eventful, but we were also so blessed to have so many people who were willing to help us out and who were willing to take the time.
Because a lot of hotels were closed. It wasn't easy to find hotels.
Exactly. And then especially, I thought that, telling them we're essential workers and we're traveling, here to help you guys out, that, I don't know, I thought that they'd be more accommodating to that. But telling people that you're working with people with COVID, it's not exactly exciting. They were kind and welcoming. They said, do you know any other hotels in the area? They gave me a list of thank you. Yeah. I mean, people were kind to us, and they were thankful, but yeah, we spent hours on the phone.
I mean, they didn't like us because we weren't 21, and we were working with COVID.
Yeah.
And it was just, we had a lot against us.
A lot against us for that. But yeah, the residency ended up taking us, and we just went ahead and booked for the 8 weeks that we were there, and that
moved our stuff in.
Moved all of our stuff in, and it became just like our own little mini home. I mean, so many people from home were, yeah.
Were you guys at the same place the whole time? Did you move around, or what was your job? Like working with COVID patients?
Yeah, so we were told that, initially when we took our job that there was a chance that we would float from hospitals because we were working in a facility that was owned under Hackensack Meridian Wealth, and so we could have switched.
There were like 20
hospitals
different
at any time. Yeah,
facilities
they told
in New
us.
Jersey, and then I think almost in New York in that area.
Yeah,
it was pretty spread
a
out.
big area. We actually stayed though at the same facility the whole time.
So there wasn't a need for us
they
to
were
move
always
at all.
understaffed, so there was really no need. Yeah, we should have talked.
Yeah, like our first day, I remember we showed up, and right away when we walked in, we thought that the building looked nice from the outside. It wasn't too chaotic, but once we
No,
went
it was
inside,
completely peaceful.
yeah,
I was like,
exactly.
there's not even going to be
Yeah,
COVID
what
here.
are the chances we're even gonna
It didn't look like the news with all the ambulances and the
exactly.
tents. It wasn't like that.
It wasn't like that. But when we went inside, I mean, it was clearly pretty chaotic. They asked us to take a seat, and then the charge nurse came and met with us, and then she took us back, and we were told, oh, you might fill up some ice waters. We
Just
really,
for your first day.
yeah, we don't want
Well,
you jumping into things. Well, you'll have an orientation day, so Lily and I were planning on sticking together and figuring it out, and I think we were handed over to the next person, and the next minute I know I'm sitting in this little room, you know, someone's writing an assignment, you're in charge of 10 different patients, and I'm watching Lily gown up with her N95 and
Yeah,
face
of
shield.
course. I got separated first. They were like, they called me out, and I was like, I have no idea where I'm going, and they like told me all the PPE to put on, and next thing you know, I was in a COVID wing by myself, and I had no idea where anything was, or any of these patients, or anything about them.
So the facility we were working at was originally, they were a really large facility. They have long-term care, which is similar to a nursing home. They also have
first floor,
acute
yeah.
care, which would be similar to what we do at Virginia Gay. But really, all of it was so, I mean, they moved some of those long-term people who got sick upstairs where there was COVID, and then there were
I
people
think
who
they
tested
started,
positive.
yeah, I think they wanted to have, when they first had COVID, like keep them on one floor, so that was kind of their logic. They were bringing everyone upstairs, and then all of a sudden people downstairs were testing positive, and there wasn't enough room. So when we got there, I mean, almost every wing
Yeah.
was COVID, I would say.
I think I remember there was
80%
one
of
wing,
people.
they had it as they called it a step down wing, so it was for people who were getting better, people who were pending, but they ended up, I remember the next day they had a PPE station set up in front of it, and they had turned it into a COVID wing. So more commonly you had the healthy wings, they just ended up just saying, we're just turning this all into COVID, we have too many people who are sick to house everyone who's healthy. So that was another thing, you know, that we ran into issues with that. Like they did their best to separate everyone, but it ended up just really not working out, and I think just about everyone ended up testing positive where we were at, and then we were also taking in people who were sick from hospitals. Where we were at, there weren't any ventilators, so we never had anyone who was super sick, but we did take people who were there for hospice, so that was the sickest that we saw. And then we also saw people who needed oxygen and breathing treatments, and
Constantly,
you know,
yeah. I think that there were
just
probably
about
people
everyone
that-
was bedridden when we got there, so we were definitely used to most of our patients being completely bedridden.
You said that a lot of the staff had it already, right?
So yes,
Yeah, so I'd say when we got there, that was their biggest problem, the facility, was the understaffing, because they were making sure that the people that were sick were being quarantined for at least the 2 weeks. And so that was a major problem, and I think that was initially how it had spread. I think that's how it kind of got brought in, and then before people knew or understand what was happening, it was spread through patients.
when things were all said and done in the time that we were there, about 75% of their staff ended up testing positive. So they had a rough time. I think we were there more on the downhill side of things, because by the time that we got there, they were able to get more PPE in, but they definitely still had a major shortage. So just to kind of put things in perspective, when we were working at Virginia Gay, we're given an N95 mask. We're fitted for that, so
Yeah, it's like a
it fits
personal
right,
thing, like it stays with
and we're
you.
allowed to wear it for 5 minutes. I think
And
total
then it's
time.
considered soiled,
It's
so you're not
soiled,
supposed
and
to
you're no
wear it.
longer able to use it. There, I met people who had used their N95 for several months in advance. I mean, every day. So they wanted us our first day. They wanted us to work 16 hours, and that's what they preferred
that
was
was
16-hour shifts. So there were people who were wearing it for 16-hour days and
Just putting it back
every
in a
day,
little
putting it in
sack
a little
and then
paper sack, and then that was. And if you wanted, if a mask was broke or it was no longer good enough to use, it had to be visibly broken or not good enough for use.
Because our
Yeah.
director of nursing had to take a picture of it and send it to like her boss to prove, like to show, because they were taking inventory. They were having problems with people stealing PPE, and I mean they did not have enough to go around. So they were really making sure that you weren't getting a new mask unless it was absolutely necessary. Do you have a question?
How often were you tested for COVID?
Yeah, so we were tested 3 times. I think a lot of that is because they are talking about like having negative or false negative tests. So
It was all within the last week, so it was a serial testing within the last week that we were there, and then we had a test on the last day, so that way, anytime we weren't exposed before then.
tell people,
Yeah.
I think, so when we first got there, they weren't testing employees as much as they probably should have been. And I think you could see as we were there, definitely, like, the government's regulation and rules were changing every day. I know, like, our director of nursing, you could tell they were very stressed and frustrated because every day they were getting a new set of rules from their higher-up bosses. I mean, it was constant changes. And so I think towards the end, they were definitely getting better about testing staff, which was good. And so that we did get tested 3 times, but it was all towards the end of this day.
So 7 out of the 8 weeks, the first 7 weeks you weren't tested.
We weren't tested.
Pretty
We
much.
weren't tested at all. Yeah.
But you were not symptomatic.
Yeah, so we were
right.
neither of
So
us
they
were
do
ever
have this
symptomatic.
screening similar to VGH. They take your temperature. They ask you the simple questions, and if you have a cough or anything like that. Neither of us ever ran into any problems, but if so, that was something they were hoping to catch with the screening.
How many people died? Do you know how many actually died that were in
Do
that
we have a
facility?
number?
We don't have a number, but sadly, the facility where we were working at was not, didn't have the best reputation in the area. They actually got on the news for being one of the worst in New Jersey, for their numbers of deaths, and then numbers within their long-term care. The number of people who ended up getting sick was.
Well, that was a very controversial thing. They talk about like what you do with nursing homes. Like if someone in a nursing home gets sick, like do you ship them out or do you not? And so where we were, they weren't, which then I think was definitely.
It caused a lot of problems. A lot of people, they didn't disagree with the way things that were run. So that made things more difficult.
And it was also hard. We saw a lot of people that were in these COVID wings that tested positive but were asymptomatic. And so they were very confused because they were taken from there. A lot of them were long-term residents. So they were used to going to the dining hall every day and like having
Seeing
family
their family,
visits.
yeah.
And then they were quickly put in this small room and everyone was coming in like we looked like aliens and our astronauts and all of our stuff. And I think especially for the older population, that was really hard for them. Because they were completely isolated from the whole world.
How were the expectations they had of you when you arrived different from what you were used to doing as CNAs?
Yeah.
Did they expect you to do something that was maybe beyond what CNAs should do?
So as CNAs, our job is to be an assistant to any sort of nurse. So any sort of administration of a treatment is kind of what it's called. We're not allowed to do ourselves. We have to either assist a nurse or a nurse has to do it completely by themselves. So it's hard because technically, like, a treatment could be a certain cream or whatever that's easily, we could easily be doing that. So definitely we were doing things out of our scope of practice there, but things like cleaning wounds or helping nurses with that. Technically we're allowed to do vitals, but we helped out with all sorts of things like that.
And that's something that in Iowa, CNAs are able to do vital signs, so we had experience doing that. But in the state of New Jersey, CNAs technically are not supposed to do vital signs, but because of the shortage of nurses, we definitely.
Administering oxygen was another one we're not technically allowed to. Oxygen is considered a treatment, but we had to do that. I mean, so many people were on oxygen. That's kind of hard. While they had short staffing with like CNAs, LPNs, and RNs were even harder to come by. So I think those people were even more stressed out and even more. For a while we were there, I never saw anyone sit down. I never saw anyone people worked so hard, and I mean that was another
The biggest difference is how many patients we were probably held accountable for. because at Virginia Gay we're just not as busy. We don't see those numbers even outside of COVID. We just don't. And we're lucky enough to have more staffing. So I'd say the number one difference I saw was just like how many people
Exactly.
that we were each responsible for. And I think the whole atmosphere is just different. I'm at Virginia Gay, I'd say we more like do things in pairs, we work more as teams, and they just didn't have the staffing for that. So we just kind of had to figure out how to do things alone, just like if it was even just transferring a patient that's really heavy. You know, normally I would feel way more comfortable if I had someone else with me, but they want to minimize people in these COVID halls, so like I would be alone. So, you know, you just kind of have to do some makeshift things that maybe aren't necessarily correct protocol, but
Yeah.
you have to do it to.
Did the two of you work together all the time, or were you each responsible?
So
for
we
certain
always
areas?
had the same hours, and we were always working in the same hospital, but
There were times where we had different assignments, we were on different floors, and so we didn't see each other the whole day. But then there were other times where we were able to work together, and so that was actually a really good thing. You know, if we had a heavier patient, I'd be like, hey Lily, can you come when you're done with this? Come and we'll do this. And we were able to tag team things a little bit more. And so we had to do things like quicker and more efficiently, but it made, many hands make slight work or whatever. So it worked better that way.
I think towards the end too, like our employers or people that made our assignments, I think started to see like that
They
we
put us together
worked
more.
well together, and
So that worked out
Getting things
nicely.
done.
Yeah, and then as we started to meet more people, more people were getting
willing to help.
willing
Yeah,
to
I think in the
help, yeah.
beginning it was just hard because it almost felt like we were just outsiders. A lot of the workers there, I think, had mixed feelings about having new people coming in. It was just kind of controversial. Not that people, I would say most everyone was welcoming, but
Yeah.
they didn't, I guess, go out of their way to help us.
We also saw, most of the people, it was a very diverse environment that we were in. So we were in kind of the melting pot of the United States for one.
That made it really.
Yeah, and so a lot of people, most of the people that we worked with, didn't speak English as a first language sometimes, or didn't.
We used our
so
Spanish.
we used our Spanish some days.
There were some days more than English.
So it just really depended on the day and who we were around, who we were working with. But there was also a little bit, there was like a cultural difference, language difference, and when you're wearing so many masks and so many layers, and someone says something to you quickly,
yeah.
you don't fully understand it, and so it's hard because you have to be patient and trying to like get that communication clear, but then we also have just a limited amount of time to get so many things done for everyone. So that made things a little bit more difficult. But it also was a really cool thing to be in such a diverse environment because we learned so much from so many different people. We met people from how many different countries.
I made a list on
Yeah.
my phone. Like I was keeping track.
Yeah.
If someone would tell me, "Oh, I'm from Bosnia," or like, "Oh my gosh," or countries I've never even
countries
heard
we
of,
hadn't
I
heard
didn't
of,
know
languages
existed.
we've never heard of before in our lives. So
Do you keep in touch with anybody from out there?
We do, yeah. I actually just yesterday I got a text from a worker we met, and our secretary. It's actually nice. They have one of like the recreation aides that we met. His main job during this time was to like walk around with an iPad so that the people could like FaceTime their families because they were really struggling emotionally during this time, and that was one thing that I think our facility did a really good job of, was trying to keep them up in high spirits.
yeah, they do like mental health screenings for some of them that have been there for a while, and then as they were getting better, trying to get them back into a routine with what sort of things do you enjoy to do, and then keeping them active too. It didn't make much of a difference when everyone was really sick and bedridden, but once you had patients start to get better, when they're in the middle of a hallway with everyone completely sick, that's a hard thing to be surrounded by as you're getting better and you're able to talk and you're able to move.
For a long time, these rooms are very small and they weren't allowed to leave their rooms, so like they say, they wanted them up and moving, like that would help them in their recovery, but it wasn't really an option. So they were kind of stuck, but
we ran into a lot of miscellaneous problems that you didn't expect. I think one of the wings that I was in was used for storage. So they originally had it in place that was it East Wing? They used it completely for extra beds, and no one had ever been in that hallway until they started getting the numbers that they started to get. So they had to
TVs weren't
move. The
working.
TVs weren't working.
which is
Yeah.
a big deal, and that's really all you have.
Well, that and the TVs were there had the phones on them as well.
That
So
was their way
when a
of
TV doesn't work,
contacting the
a phone
outside
doesn't
world.
work, so they have no way to
A lot of
contact the outside
times, I
world.
know, we would go and we would grab our cell phones, and we
Wasn't
would
allowed,
let
but
people call
yeah.
their families, and then we would just sanitize them because we felt very
So what's next for each of you?
Yeah, so I'm going to be attending the University of Iowa in the fall. I'm majoring in biomedical sciences, and I'm hoping to continue my education and hopefully go into the medical field.
Yeah, I'm going to be studying biosystems engineering at Iowa State. So I hope to continue my education as well there. But yeah, we're both like really interested in medicine, and I think a lot of people ask us if our experience in New Jersey deterred us at all, and neither of us
I would
can
say
really
not
say
at all.
not at all. If anything, it made us both like more enthusiastic about the medical field. You saw the worst of medicine when it came to the shortages and the problems that we saw, but we also saw some of the best. You see people rallying together and working together, and in a time where it seemed like the world was just not getting along and falling
Chaotic.
apart and everything was chaotic, we saw people from all over the world, people come together with just to help one another, and that was a really cool thing that I think we got a unique perspective to see that a lot of people didn't, so we're really glad about that.
What's your best advice for us to stay healthy? What would you say to us here in Iowa to stay healthy and as we
No
look at the
congregating.
schools maybe being open?
Yeah, it's hard because things seem so different, like when we get back.
Well, there are a lot of people who have a lot of big decisions ahead of them. Honestly, we're kind of glad that we don't really get much of a say in that, because you saw so many different perspectives about how you fix things and how you
Watching
make
the
things
news
better.
is so conflicting.
And we got so many different news stations, we saw so many different perspectives, and people there have a different perspective living in bigger cities than we do living in rural Iowa, which makes a big difference. But it's hard.
We
really-
had 65 cases in Benton County.
Yeah.
65. I'm sure where you came from, the percentage of cases, there was
Yeah.
2,100 or 2,200 people tested in Benton County, and there's only 60-some. And 50 have already recovered, and we had one death, and I think that person was, 83 years old. So, I mean, the amount we have here versus Lynn County or Blackhawk County, there's a big difference.
It's different. Yeah, exactly. It's hard because it depends on where you live and what sort of demographics you're looking at to sort of make those decisions. But really, I think I would just say to follow the advice that like the CDC and all those organizations, because really it's the best information we have so far. I mean, things are constantly changing, and that's hard because we don't fully know what the right answer is, but I know everyone's doing their best to do what's healthiest for everyone. So.
Hey, any other quick questions here? Keith?
How long recovery did people have from the time they came in the hospital till the time they went home?
That's a good question. So that really varies.
Really varies.
I mean, drastically. I don't even know what we could say for an average. There are people, though, definitely that when we first got there, like Harley and
Had
I
already been sick for a while.
Yes, right. Had been sick for a while and were bedridden, but I didn't think we're going to recover, and it was cool. I mean, like, it was a really slow process for a lot of people. I would say, like, just in our last week, it was cool because they were able to stand up, or they were able to, walk to the bathroom. But then there were older people that had pre-existing conditions that kind of fit the demographic of people that we would say are more at risk, and they tested positive and were completely asymptomatic. I mean, there were a lot of those cases too that we did see, so I think there aren't really any rules that just fit. You can't like say something that fits for everyone.
That's what's hard is, I mean, a lot of times they'll say if you're older, if you have pre-existing conditions, and that makes it that that does make you more risk, but you see
And
those
we talk
exceptions.
to
And
workers.
for literally every single rule that's out there, there's an exception, and I could tell you a story about the exception. So, I mean, that's what makes it hard is, people say, well, I've heard on the news about this, or the CDC has said this, or I've heard from my friend about this. And while this is true, and we could say, that is true, there's always an exception to that rule. So that's what makes it more difficult. If you're more surrounded by those exceptions, then you start to think that maybe the rule is the problem, and then it gets really confusing and complicated. So.
Well, I think we all feel very proud to have these two young ladies represent Vinton and Vinton-Shellsburg schools. I mean, it's a tribute to your family, to the school system, and to you yourselves for doing that kind of service. And that's just great. Let's give them a big round.